All right. Good afternoon, everyone, and welcome to today's webinar, Putting Health and Environmental Assessments, the How-To of Health Assessments, which is our fourth and final in this introductory webinar series, Introduction to Environmental Assessments and the Role for Public Health. Today our focus is on one of the steps required to conduct or participate in a health assessment, and an excellent and an element or as a standalone of an EA. My name is Lorenzo Mele, and I'll be the moderator for today's session. The webinar is being hosted by the Ontario Public Health Association's Built Environment Work Group, which I am a member. OPHA's activities as a nonpartisan, nonprofit charity brings together a broad spectrum of groups and individuals from a variety of sectors, including public health, healthcare, academic, nonprofit, and private sector. OPHA's mission is to provide leadership on issues affecting the public's health. OPHA offers professional development, such as this webinar, information analysis on issues affecting health and advocacy, and consultation on healthy public policy. Being a member of OPHA is an excellent way to build a network with other like-minded professionals, and if you're already a member, and if you're already not a member, I encourage you to join. The Built Environment Work Group is one of several OPHA work groups that respond to the public health issues of provincial interest. One of these issues that we've identified through a 2019 survey of Ontario public health units was that there is an interest in engaging in environmental assessment process, specifically related to transportation and roads, but a limited knowledge of how best to do this. So we carried out the survey, the tremendous interest in the survey, and 50% of health units that we surveyed at that time were not completely familiar with individual EA, and that, as I mentioned, prompted us to engage in the webinar series that we're doing right now. So as I mentioned, this is the webinar presentation today, focus on the steps required to conduct a or participate in a health assessment as an element or standalone EA. Our aim is to highlight for you some of the questions that should be asked when deciding whether to get involved in an EA, and how to effectively participate once health is invited to the table. So the three important takeaways, objectives today are learning how using the health assessment approach to help to address psychosocial aspects of a project like a landfill are important. Understanding the checklists of steps needed to advance the use of health assessments in EAs, including screening as a pre-step to determining how a health unit decides whether a health assessment is required as part of the EA process. And then finally, an introduction to a list of resources that a health unit can access when conducting a health assessment as part of the process. Also, since this is the final webinar in our four-part introductory series, we'll be seeking and inviting your input as participants on the barriers and opportunities you have when participating in EAs and how OPHA can continue to provide further support to health units. Shortly, we'll be carrying out a survey to better understand your capacity, knowledge, and needs concerning environmental and health assessments to help inform future webinars and or workshops that OPHA could host to foster knowledge sharing and professional development. Today's webinar will be recorded, and the presentation will be made available online. All participants will be muted, but we invite you to participate by using the chat function on your screen. Feel free to ask questions or add comments. I'll pose the questions to our presenter during the Q&A after the presentation. So to get us started, we have a few short questions to find out a bit more about you and your intersect with this work around environmental assessments. Calden, can I have question 1, please, on the screen? So real quick, have you participated in any kind of environmental assessment in the past? Basically, yes or no. Perfect. So I think you can see that, about almost a 50-50 type of split. May I have the second question, please, Calden? What is your current level of knowledge around environmental assessment process? Perfect, and I think that that's fine. We've got those results. So, you know, low to moderate, standing out, very low. Perfect, okay. And our third and final question, please, Calden. And finally, what types of EA consultations do you see being most relevant in your work in public health? And if you do choose other, I believe there's a way that you can identify or be more specific.
If other, could you please specify in the chat box below, please? Thank you.
There were a few others. It looks like people have shifted. So if there's anything specific you want to include at this point or even later, that's great. Okay. Thank you for that, for indulging us on that. It's important so we can kind of gauge where we're at in terms of our audience and subsequent efforts around knowledge sharing, professional development. Okay, with that, I'd like to now introduce our presenter. Faiza Waheed has her PhD and Master of Environmental Science. She's an HIA specialist and environmental risk analyst. Dr. Waheed is a health impact assessment specialist and health analyst at Intrinsic Corp and a member of the Built Environment and Health Working Group of OPHA. Her primary focus is the use of the HIA paradigm or more general health assessments to assess potential positive and negative impacts of major built infrastructure projects and policies on health. More recently, Faiza co-developed a framework for the Ministry of Transportation of Ontario to incorporate health impact assessment into MTO's Class EA process for major transportation projects. Currently, Faiza is involved in HIA's gaming facilities as well as health assessments of 2 proposed landfill projects. Given her exposure to conducting HIAs in different sectors, she is well-versed with HIA health assessment methodology and the common pitfalls to be avoided during the process. Faiza is experienced in conducting scoping workshops as part of the HIA process and engaging stakeholders from diverse backgrounds such as public health, transportation sector, non-governmental organizations, academia, and the private sector. Welcome, Faiza.
Thank you so much, Lorenzo. Good afternoon, everybody, and thank you so much for logging in. I hope everyone can hear me loud and clear. Lorenzo, if you could just let me know if you can hear me, I'll begin immediately.
Coming in loud and clear, Faiza.
Okay, perfect. So the outline for my presentation today, I hope, is going to be as advertised. So initially, we were thinking that when I presented the health impact assessment webinar previously, it's not always that, public health units or in Ontario and Canada, we get to do health impact assessments. More common are general health assessments. They're known by a variety of different names, but these get conducted on small to medium to large size projects. So this webinar is geared towards understanding how we can grapple with these general health assessments and what are some of the methodologies, resources available to help us conduct them. So initially, first I'm going to touch on some triggers for doing health assessments, given that we don't have any regulation in Ontario for doing these. Then I'm going to go through some of the steps involved and I sort of provide you with a checklist, if not even leave you with resources that have checklists in them when you going through each of these resources, each of these steps, and ultimately the list of resources that you can access. Moving on to slide number 3, I thought I would jump straight in and talk to you about a specific example in Ontario. So this is a proposal for a landfill in southwestern Ontario. It's called the Southwestern Landfill. The proponent for this project is Walker Environmental. So this proposal is currently undergoing the environmental assessment process. The reason I bring this up is because as part of like the initial planning stage or the initial terms of reference, there was no requirement for a health assessment beyond what the human health risk assessment does, which is where Intrinsic was involved. We are doing the human health risk assessment for this environmental assessment. And in this review of these initial terms of reference, the acting medical officer of health for Oxford County, which is where the proposed landfill will be situated if it is approved, he identified potential for health-related effects extending beyond those addressed through the HHRA, which is air quality, groundwater, soil, and what are the physical impacts, and at what point do you have an increase in physical harmful effects to the community. So he thought that the interrelationships of social and economic constructs of the proposed landfill were not being addressed through the health component of this EA. So when he submitted his concerns to the Minister of Environment, there was a change in the terms of reference that required for a screening level review of the socioeconomic assessment results to determine the potential for health-related effects. So you will notice the things that I have highlighted out in bold, where the minister says that early in the environmental assessment process, prior to finalizing any work plans, the local medical officer of health should provide input to whoever is conducting the health assessment, the human health risk assessment, so that they can include at a minimum the determinants of health that will be assessed, the different stages of assessment that will be undertaken, and he also outlines a methodology that was proposed by the acting medical officer of health for Oxford County. Oxford County Public Health is now known as Southwestern Public Health. They have amalgamated into like the Speaker Public Health Unit. So I'm not sure if anyone from there is on this call, but I have permission to speak about this project from Walker Environmental, who thought that this project was a great example of how the EA process is flexible enough to allow these types of supplementary health reviews to be incorporated and assess more holistic health effects. So it's not just as part of the initial screening process where the supplementary health review is supposed to take place, but also if at the end of the project of the EA process there are potential negative health impacts identified, the Ministry of Environment recommends that the medical officer of health for Oxford County work with the health expert and anyone else who has expertise in the area and is part of the EA process to work out mitigation measures and to ensure that there are no or minimized negative impacts to the community. So this was a great way in which, although there was absolutely no supplementary health review or health assessment or anything to begin with, as it moves through the terms of preference process, the acting medical officer of health for a particular community reached out and identified the need for something like this. So this is a slide from the very first webinar we had, where Greg Janish from the Ministry of Environment and Climate Change talked to us about the environmental process. And here he mentions that in an individual EA for major built infrastructure projects, there are two components. The terms of reference, like so the initial sort of planning stage which sets out what the EA study will look at, and then the EA study itself. So in this particular case, we had intervention from a public health unit at the terms of reference stage that sort of sets the stage for help, the broader health impacts to be brought into the picture from the very beginning and going all the way into the EA stage. So this, I tried to list out some of the health determinants that will be considered as part of the supplementary health review. Not all of them are listed here. This work plan is in the public domain, and if you are interested, you could look it up. So for example, we have air, dust, groundwater, which includes groundwater and surface water, which are already included in the HHRA. But we also have health determinants such as neighborhood aesthetics, traffic concerns, economic, social and cultural heritage. This is where the perception of hazards, including the social psychological impact to the community, comes into play, as well as the built environment. So as part of the scope of work or the work plan that we prepared, that Internship prepared for this SHR, for each of these health determinants that will be considered, data from the relevant EA section. So obviously for the economic assessment, looking at the health impacts related to the economic factors, we will pull information from the economic assessment of the EA and supplement this with public health data as well as scientific literature. So that was just like a sort of initial introduction to how a general health assessment that is not an HIA, can play out. So having started off with that, I want to ask you this question. So, what is your level of knowledge with respect to health assessments in general that are conducted as standalones or within EAs or built environment projects? So in the transportation sector, waste management, water treatment, so on and so forth. Okay. I hope that with this webinar, I'm able to sort of, if not, shed more light on this process, but at least point you towards resources that will help you get more involved. As you can see, like the reason I led up with that example is because public health officials have not just the knowledge, but the ability to sort of make themselves heard when major projects such as these come up and have an impact on community health. So health impact assessment, if you would notice the methodology proposed by the minister, which was recommended to him, obviously by the acting medical officer of health, is very much similar to what the health impact assessment framework looks like. You have screening, the decision to go ahead and conduct the health assessment, scoping, plan out what exactly you're going to assess, and then the actual assessment itself, followed by the recommendations which are based on the assessment. Then you're reporting the results of this assessment and followed by eventual evaluation and monitoring, not just on how the assessment was conducted, how well the assessment was conducted, but many years following the monitoring process, evaluate what impact the health assessment had on the decision-making process and how it was able to improve community health as a result. So, I mean, this is a great framework. I would argue that health impact assessment is sort of the gold standard when you're conducting health assessments, but not always does like the department or the government or health unit have the ability or the resources or the funding to go into a full health impact assessment, which sometimes can be a difficult concept because there's no regulation for something like this, and departments aren't really willing to delve into something they don't always understand. So as long as we don't have regulation for something like this to always occur as part of major projects, we have to sort of try to use workarounds such as health assessments or supplementary health reviews or health assessment studies, things like that. They would follow pretty much a similar framework because, I mean, this is a really good way in which to make sure that your health assessment is being conducted in a systematic fashion. It is following a logical series of steps, and it is an evidence-based assessment. So just using the general framework of the HRA process itself, we can start looking at how a general health assessment is going to look at a particular project concern. So screening, the first step, is a decision where you decide whether or not you want to get involved in the EA. Oh, perfect. Sorry, I just saw that comment. But the presenter could slow down a bit, that would be helpful. My apologies, sorry. I have limited time to get through this, and I was hoping to make it quick. I will slow down. So the first step is screening, where we will be making the decision to get involved in the EA. So there's, I have heard from friends or colleagues in the public health field who are working as public health professionals say that they are sort of sometimes bombarded with so many different projects that are happening and they don't always know how to decide whether or not they should get involved in a particular project. Is there an easy way for them to sort of screen these projects and come to a quick decision as to, among all of this pile of projects on your desk, which are the ones that would be sort of most suited to a health assessment? So the first step is as it's very important. It's a rapid assessment of relevant potential health impacts as well as what the scale of these impacts are. So, I mean, in deciding whether or not to conduct a health assessment on a particular project, a good way to sort of start is to try and understand what the level of public concern is related to the project. I mean, is there a general lack of understanding that you believe is sort of within the community that is making them vehemently opposed to a particular project? Is there a strong social media fueled opposition to the project as a result of some misinformation that is available out there? Or do you think that this is a particular project that does need a holistic health assessment to be conducted and not just looking at the human health risk assessment in terms of air quality and just and groundwater and soil impacts, and determining what the negative impacts might be, but also looking at what the potential positive impacts of something like this are. So you would use your professional judgment and go on to assess the likelihood of the health impact and what the magnitude is. So for example, just really quickly, if we're talking about a major corridor being elongated or widened within a community without the appropriate number of sort of pedestrian walkways being put in the middle, you can imagine that the likelihood of accidents and traffic-related injuries would go up. And if the speed limit on that particular corridor is very high, then the magnitude of these injuries would also be pretty high. So, I mean, just using professional judgment and something like that, I mean, a rapid assessment could bring you to sort of a point where you can make a decision. And also importantly, it is good to consider what the vulnerable populations at risk are due to the proposed project. Of course, you have children, seniors, lower socioeconomic status individuals, so the socioeconomic and environmental justice aspect of things, indigenous groups. So, as public health officials, we know that equity plays a big role in determining our health. And it is something that we should be considered when you are looking at potential health impacts of major infrastructure projects. So look at the plethora of different health impacts that can occur as a result of a project. This is sort of like the backbone of social determinants of health diagram, so to speak, from which many different types of pictures have evolved by Dahlgren and Whitehead. This sort of lists out the different areas of our lives in which we can have impacts to our health because of a given project or policy. This is a good place for us to start. And the National Collaborating Center for Healthy Public Policy has actually listed out the screening tool that you can quickly use to sort of go through the determinants of health and try to sort of quickly assess whether there is a potential impact to these determinants due to a given project. I've provided a link to this over right next to the table, and this is just a screenshot from part of that screening tool. Obviously, it lists a lot more determinants of health, things that would be more relevant to some projects versus others. And this is a tool that's readily available that health units can use when you're trying to do screening. Okay, so some other factors that you need to think about when you're screening projects and try to decide whether a health assessment is necessary is looking at the time at which this health assessment would be becoming a part of the EA. At what stage is the EA currently? Are we at the stage where we are selecting the preferred alternatives? Are we at the stage of the terms of preference, the planning, or is the EA report right now being assembled? Or are we at the stage where the EA report is assembled, but there's a review process going on? So depending on which stage you are at, obviously being involved in the EA process as early as possible would be the best option. But depending on at the stage in which you are getting involved, there is limited probability of impact that the health assessment may have on the decision-making process. With this, there is also the consideration of what should be the depth of the health assessment. Depending on how much time or resources or funding is available, rapid, intermediate, or in-depth assessments can be conducted. Funding is a major issue, whether the health assessment would be conducted internally, whether an external consultant would be hired, or is there some sort of combination of both. The resources available, which is, of course, how much experience you have within your public health unit to do something like this, or are there resources readily available that could be used to conduct a health assessment? So what are the tools available? And very importantly, and something that's not always considered, is what is the information or data available for the assessment? What is publicly available? What is available in the public domain? And is there a way that primary data collection could be considered within the funding and the time period that's available? So once you have made the decision to sort of go ahead and conduct the health assessment, we're now at the scoping stage. So this is, looking at the roadmap. What are the main health issues? What are we going to look at? How are we going to look at this? So again, here I've used sort of the scoping tool or the list of scoping questions that have been developed by the London Health Observatory, so the National Health Services of the Ministry of Health in London, UK, that have then been adapted by the National Collaborating Center for Healthy Public Policy. And I've added a few comments of my own here. So this is all publicly available information that you could access if you need it. I have links to that later on at the last slide. So again, the time scale for analysis of impact. Would you be doing the health assessment covering just the construction phase of the project, or would it also look at the operation phase? What are the geographic boundaries? How do you decide which communities to look at? Would you just look at the community immediately surrounding the project area, or would you go a little bit wider? So this is sort of determined by the extent of public concern that exists around the project. Again, same thing, population covered. So depending on what your geographic boundary is, and perhaps population covered can also consider vulnerable groups or populations who may not necessarily be within that geographic boundary, but maybe just on the edge. And this is a consideration that is important to have. So then develop an explicit hypothesis concerning potential health effects. So a logic model, if you will, or a pathway diagram. I will show you an example of that. Actually, let me move on to that slide right now. So this is an example of a pathway diagram, which is looking at a particular transportation policy, implementation of tolls on highways, and sort of following through what the different determinants of health that are potentially affected by this policy are, and then what is the health outcome at the end of this pathway. So sort of like having a clear idea as to what are the different determinants of health your health assessment will consider, and what are the health outcomes that you are most interested in. So having something like this clearly, explicitly laid out, your hypothesis, if you will allow you to focus your health assessment and also and let you know what are the resources, what are the information, what is the data that you actually need to be able to assess all of these things. Going back. So criteria for prioritization of health impact, using the knowledge that public health officials have, asking sort of air quality having, is being a major issue when it is a transportation-related project, and so on and so forth, and using stakeholder feedback to guide that prioritization. So then the methods of assessment, sort of, going through the baseline profile, whether you need data collection, primary data collection, what is the literature available that you can use to do your assessment? Would you need to conduct surveys? Would you have the time or the money to conduct surveys, which, as we know, requires both time and a lot of money? Epidemiological information, whether the size of population for the community that you are interested in, whether there exists epidemiological information for that small population, or would you need to go a little bit wider? For example, going back to that Southwestern landfill project, so the proposed landfill is supposed to be in the township of Zora. So the amount of health information available for a baseline profile for the township of Zora is not a lot. So from Statistics Canada or whatever is available on the Oxford County website, the former Oxford County website, is not as much as there is for Oxford County itself. So you might consider having less information for that specific small community and using more information for the bigger community. So this is all something that you would have to sort of look into using Google or any other means, decide how much information there is. The various stakeholders and the nature of their participation is, of course, a huge role in the scoping process. So you need stakeholder feedback and into the scope of the assessment, the methodologies, the data sources, and then following that, the recommendation stage when you get to that, and the draft report itself. We've already concluded this. Okay. Next, when we're again considering scoping, it then comes like sort of the more banal but extremely important aspect of management and how you would manage the assessment itself. You know, who is going to do the assessment, whether you have an internal process or whether you will hire someone externally. How would you manage, you know, the assessors that you're hiring? How would you, you know, provide feedback into the assessment? And make sure that we have strict timelines and deadlines for when a particular step of the assessment is completed. For example, Gantt charts are great in trying to maintain and keep a track of how the assessment is progressing, which, you know, if you know anything about health assessments, you know that it is very easy for them to become, you know, bigger than they should and go out of, you know, their timelines and out of budget like super quickly. So it's very important to have a handle on how this is working out. And being prepared with that in the very beginning during the scoping stage really helps keep track of the timeline and the budget. So the responsibility for decision making is also another concern that, you know, one must have when you're doing the health assessment, and always keep thinking about what the report ultimately will look like. As we're going through the health assessment stage, what are some of the key issues that need to be addressed? Because when we're reporting on this, the decision-making process should take the health assessment into consideration. So as long as we make the health assessment to point and something that is considering stakeholder concerns, you're on the right. So essentially scoping, it's the roadmap. This is a slide that sort of summarizes pretty much everything else that I've said so far. And just to sort of reiterate that your initial assessment of potential health impact that you did during the screening stage, where you decided that yes, there are potential health impacts, and this is the likelihood, and this is the magnitude, this is what should drive the scope, as well as consideration of what vulnerable populations there were in that very beginning step. So now, polling question number 2 is sort of going to ask you whether you believe there's enough support in terms of, like, you know, the knowledge to conduct health assessments, resources, the budget within your organization when you're conducting these health assessments as part of EA. Okay. So that was low to medium level of support, which is, you know, fine because, I mean, luckily we have a whole lot of resources available that are easily accessible that will, you know, enable pretty much anyone to be able to conduct a health assessment, hopefully. Well, again, the question then becomes time and funding, but that is, you know, not something that external, you know, online resources can help with. But moving on to the next step, which is stakeholder engagement, I see this as a next step, but this is something that sort of is a part of the health assessment from the very beginning. So stakeholder engagement, it cannot be understated how important this is to any sort of health assessment. It's because of stakeholder engagement that you know that the health assessment that you're conducting actually is looking at the right issues. It is looking at the issues of concern with the public, with vulnerable populations, and it is not a biased assessment because you have a whole group of people from different backgrounds that are able to provide feedback as you develop the scope of the assessment and provide with the right type of methodology, looking at the right data sources, making sure that a really important report that has been published on topic X is not somehow overlooked when you're conducting the assessment. So all of this sort of comes under the umbrella of stakeholder engagement, where they're not just sort of, the scope of the assessment, but also towards the end when you're making the recommendations, when the assessment is complete, and from the assessment results, you make the recommendations and provide mitigation strategies. So this is also where stakeholder engagement plays a huge role. And so these are local health authorities, subject matter experts, community representatives, government, academia, or the project proponent themselves. But in my opinion and in my experience so far, like local health authorities are a huge resource when it comes to stakeholder engagement, and not just with the knowledge that they have, but also being able to point to other stakeholders who might have very useful information or who have genuine concerns when it comes to a particular project. So when you're doing the engagement, it is important to have multiple opportunities, so not just the initial steering committee meeting, so within the public health unit itself, together with the proponent or government, but also having scoping workshop, either one or more than one, when you're deciding what the scope of the assessment should be. And this also has the added benefit of ensuring that your scope is not biased, because you have a multidisciplinary group of stakeholders who are providing input into the scope. And also sort of deciding the most relevant data sources that can be used, and that local knowledge and expertise that also gets involved. It also gets brought into the health assessment. Then the health assessment itself, so the assessment phase. So the first part of an assessment phase, well, as per the HIA framework, but even more generally, as good practice, is to establish a baseline profile that outlines what the current conditions in a particular community are. So it's important to understand the health status of the community as it stands right now, to be able to identify what potential health impacts might happen in the future as compared to what the current status is. Also, so using a baseline profile, you can identify and better understand the issues faced by not just the community, but the vulnerable groups that are affected. So that's the first part. And then following that, going back to that first point, the baseline profile, like I find that Statistics Canada and the public health unit, the website for a particular municipality or a region, has a lot of information specific to the community in which you're looking at. There are many reports that public health units generate that are specific to their own communities, ranging all the way from air quality to opioid overdose, to built environment and how that impacts health. And all of these things are very community specific. They need that context. So I find that like the websites for public health agencies, have a whole lot of information that is very useful when you're building a baseline profile. Then once you've done that, going to the actual assessment stage, the information that you can use here, it can be brought in from the EA. So there are many different EA reports. When you go back to that Oxford County table that I had when we're looking at the different health determinants, there is like specific sections of the EA that you can refer to pull information that is the most recent and contextualized to the project in mind. Then we can look at similar assessments if there are available. So how many different jurisdictions probably have considered or done health assessments on landfill projects? There's probably a lot, right? So those are also sources of information. input from stakeholders in the community, other government reports, non-government organization research and publications that are there, data clearing houses, academic literature, focus group data, survey data. The last two is sort of a more primary data collection endeavor. And as you probably know, that this is sort of something that can only be done if there is a lot of time as well as funding available. So these are some of the sources that can be used when you're going through the assessment stage to be able to sort of use the baseline profile that you have built together, focus on the health determinants, and using all of this information, come up with an assessment that looks at how the project or the policy may impact these health determinants of concern. So when you're assessing the significance of the impacts, so this is sort of like a screenshot that I have taken from the Planning and Community Health Center of the American Planning Association, where they consider HIA and how that plays out when you're through the planning process. So sort of when you're looking at characterization of health impact beyond just, positive or negative, you can look at things like what is the direction of the impact? What is the magnitude of this health impact? What is the severity? What is the likelihood that this impact will occur? And last but not least, what is the distribution of the impact? Is it shared equally in the community, or are underprivileged or vulnerable populations more affected by this particular project than others? So then after the assessment, based on what the results of the assessment are, you make recommendations, that are practical, that are made to enhance potential positive impacts and mitigate any potential negative impacts. And this is not a point that I can stress enough, that, when you're doing this health assessment, this health impact assessment, whatever you want to call it, a supplementary health review, it's not something that you would just use to identify the potential negative impacts and try to mitigate those. But it is also a process by which we can identify the potential positives of a particular project and do everything we can to enhance it. So, this also brings me back to the first step, like the screening step, where we were looking at, whether or not we should conduct a health assessment, and this was based on, identify what health impacts there are. Perhaps there is a project due to which there aren't any negative potential impacts, but there are positive impacts. Then a health unit, time and resources available, can decide to get involved in that, the environmental assessment for that project, because this is an opportunity to enhance the potential positive impacts that they are able to identify, which sort of has the added benefit of, having public health play a role in, benefiting the community's health. So again, the recommendations should be based on evidence gathered during the assessment phase, and stakeholders and, getting feedback from stakeholders is really important at this stage, because we want to make sure that the recommendations arise from the findings of the assessment, and they are not recommendations that are just made because it just seems it's, the right thing to say or the right thing to do. But these recommendations are based on evidence that is generated during the assessment phase. So then the reporting phase is essentially just not producing, one full-length report with all the technicalities that were part of the health assessment, but also consider sort of, using fact sheets, one-pagers, and information that is easily disseminated and can be communicated quite easily with someone who doesn't have any knowledge of what health assessments are. Okay, so this brings me to my last question. So if not conducted in-house, how comfortable are you requesting a particular proponent or the government to conduct health assessments as part of EAs for major built infrastructure projects? Great, medium level of comfort. Given that we lack regulation to conduct health assessments that, if we think about them logically, should be an automatic part of EAs for major built infrastructure projects, approaching proponents or government, and identifying the need for health assessment is pretty much the only way we have as of now to make sure that, the broader health determinants are considered as part of these major projects. So the last slide for me would be the resources available. So the National Collaborating Center for Healthy Public Policy has an amazing list of resources for health impact assessment. Again, we're talking more about general health assessment, but it's not to say that the resources available for health impact assessment cannot be used and adapted to conduct these more general health assessments, if you like. So there's HIA training courses. There are tools for HIA screening. There's a snapshot of that I showed you. There is a sort of a cost calculator that lets you calculate what it would cost to conduct a health assessment, sort of a scoping tool, sort of an assessment, a list of resources that you can use to conduct the health assessment itself. And internationally, we have the World Health Organization that also has a list of resources for health impact assessment, and you can take that as read for health assessment in general as well. The CDC has a list of resources, and that link will take you to them and you can identify them. The Pew Charitable Trust is one of my favorite places to go when I'm doing any type of health assessment, because this has a clearinghouse that identifies HIAs or health assessments conducted in many different sectors across the United States. So for example, if you are thinking about conducting a health assessment on a wastewater treatment plant that is planned or proposed for your community, there are health assessments that have been conducted on this type of project. And going through these health assessments will help you sort of visualize what a potential health assessment, if you were to conduct it, would look like. So that's a really good resource. Not just that, but there's also methodologies, guidance manuals available for doing health assessments. And last but not least, the American Planning Association has this toolkit. Like I showed you a snapshot of that as well, but I like this a lot because it sort of aligns sort of the health assessment with the planning process. So if we're considering doing a health assessment while the project is in the planning stage or policy is in the planning stage, then this is a really good resource for that as well. Yes, the National Collaborating Center for Healthy Public Policy is now offering a new free online course on health impact assessment. And it's I haven't taken this course personally, but given the kind of resources that NCC HPP have in-house, I'm sure that it would be a great learning opportunity. Which brings me to the very end. Thank you very much for your time. And if you have any questions, I will do my best to answer them. And I hope this was a useful presentation and useful, and thank you for your time.
Excellent, Faiza. Thank you. And I'll speak on behalf of the group, if I may, in that HIA can be a daunting consideration for a public health unit, and I know there's a certain amount of trepidation in terms of engaging in them. And I think that your remarks, especially around scoping, for me personally, give me a whole lot more comfort. So thank you for that, Faiza. So at this point, we do have a few minutes remaining for question and answers. If you can use the chat box, that would be appreciated. The other thing that we would ask, if you can, we know that there are a number of people that, number of organizations that have registered, and you may be having, a brown bag lunch around a boardroom table. And if you could include in the chat box how many people are with you, that would be appreciated. And so we're taking some questions now. Caroline is typing, it looks like. So we'll just wait for questions to come up. Faiza, I do have one question that you might be able to sort of give a little bit more insight into the group on, and that's this notion of connecting the HIA process with a broader public consultation. Often in our practice, we'll engage with the public, and they'll come to us with certain questions about the given project that might be, and sometimes we're not in the best position to answer those questions. So how do you see sort of the HIA process maybe linking into that broader public consultation?
That's a great question, Lorenzo. It links in extremely well because, as you know, like I was talking about health assessments in general, using information from EAs, and EAs involve huge public meetings. If it's not an EA, even generally, as part of the Vision of Fields project, like if there are public engagement sessions, that's information, and this is all information that is recorded somewhere, right? So there are notes that are available from the questions that were raised and the concerns that were, the public had and that were expressed at that time, or there are emails or letters that have been sent as a result of concerns related to a particular project. And all of this is information that can be directly pulled into the HIA or the health assessment, where you're using this information not just in your screening phase, where you're deciding whether or not to go ahead and do a health assessment, but also in the scoping phase, because now, by this process, you are able to identify some of those health determinants that are, of very high public concern, or that, genuinely feel like, something that a public health unit should look at. And then going back into the assessment phase as well, you're able to take this information that is generated from these public meetings through the whole process and make sure that the health assessment has heard as well as addressed the concerns that were expressed.
Mm-hmm. Thank you.
Does that answer your question?
Yeah, no, it does. Thank you for sharing the insight. Okay, there are a couple of questions here. Ottawa Public Health wondering if there are any example reports that can be shared for review. So I suspect these are example HIA reports. Faiza, I don't know if there's anything readily available that we could bring to the attention of the participants.
Sure. Yeah, like I mentioned, going back here, the Pure Charitable Trust, like this website, it's an actual clearinghouse for sample reports that are health assessment reports on that are conducted on different types of projects in different sectors. So if you want example reports on transportation, that's there. If you want a report on sort of waste management facility, health assessment report on that, that's there. And then I can sort of put in a plug for myself. So I have sort of a review, like a scoping review of transportation health impact assessments that have been conducted worldwide. And sort of, I provide a list of all of these transportation health impact assessments. And if you're interested in that paper itself, it's listed and sort of talking about what the level of expertise in these health assessments is and what the standard is and what some of the sort of areas for improvement are. So there's example reports available on pretty much health assessments that are done in many different sectors in different jurisdictions around the world.
Great. And Faiza, that report that you just referenced, what journal was that in? Remind us.
EIAR, Environmental Impact Assessment Review.
Right.
Yeah.
Okay, Peter Haywood, to learn more about the proposed Southwestern Landfill project, please visit. So obviously Peter is directly involved in this work. So thank you for that, Peter. And we can share that link. Obviously you'd like us to share that, so that would be a good thing to do. Got a couple more minutes. I don't know if anybody has any questions for Faiza. And I know a few people have been entering the number of people that they're with. So thank you for doing that, everyone. that'll help sort of gauge the response and sort of subsequent planning for the webinars. Looks like we're pausing on the questions, so we're approaching our time. At this point, I just want to say thank you to FISA for an informative presentation, and all of you for participating, asking questions, and I encourage you to continue, or in some case maybe start the dialogue between public health and you know, the public works agency maybe in your community on transportation or other infrastructure and planning initiatives. Also thanks to Calden at the OPHA for all the technical support to get the webinar coordinated and presented today. Thank you, Calden. Finally, this is the final webinar in our 4-part series on human health and environmental assessments. And as we mentioned earlier, we'll be reaching out to you concerning future webinars and or workshops that OPHA could host to foster knowledge sharing and professional development in our public health community. And finally, a reminder to please complete the webinar evaluation survey, and a link to the survey along with the webinar recording and presentation will be emailed to you early next week, it appears. And with that, I'd like to say thanks again. Enjoy the rest of your day. Keep dry. And if you're cheering for the Raptors, go Raptors. Okay, take care, everyone.
Go Raptors.